you're watching us on Facebook Live because we are celebrating our St. Luke's Skin Week. My name is Dr. Ivan Singson. I'm an active consultant of the St. Luke's Dermatology Department. Our guest speaker is the head of the Department of Dermatology in Quezon City. She is currently the head of the Woes Unit, Dermatology Center of St. Luke's Medical Center in both Quezon City and Global City. She did her Woes training in Harvard Medical School. Let us welcome back Dr. Cynthia Tan.
Thanks, Ivan. Thanks, everyone. Good evening. And thanks for the warm introduction.
You're welcome, Doctora. So for our viewers out there, please feel free to type in your questions at any time. So let's just get this ball rolling and let's begin. So my first question is, what is skin cancer?
Well, skin cancer is any malignancy of any part of the skin. So malignancy means uncontrolled growth of any part, epidermis, dermis, or subcutaneous area, or even parts of your glands or skin, hair, and nails kasi ang dermatology, right? So
Correct.
Any part of the skin that has an uncontrolled growth can be called skin cancer. Of course, we're not talking here of lymphomas of the skin, okay? And basically, skin cancer can be divided into two groups, your melanoma group and your non-melanoma skin cancer.
Okay, Doctor, since you mentioned that there's two groups, how do we differentiate those two groups of the melanoma and non-melanoma skin cancer?
Okay, melanoma is cancer of the pigment layer of the skin. So we have our melanocytes, right?
Correct.
So these mga skin cancers can be identified using the ABCDEs that we know. A standing for asymmetry, B for irregular borders, C is for variegated color, D is for a diameter ng nunal bigger than 6 millimeters, or something that is different from the whole body. Let's say you have a lot of moles, may isang different dyan. So that's the D. And E is for evolution, how the lesion has been changing in a short period of time, like in 3 months' time. Now, kaya meron melanoma kasi the rest of the skin cancers are considered non-melanoma. And the acronym for that is NMSC. Okay? The most common among the NMSCs is what we call the basal cell carcinoma. Actually, 80% of skin cancers is actually basal cell. Okay, basal cell, usually, they look like the basal layer of the skin. And usually, they grow dun sa areas na mga kitang-kita, so exposed to the sun. Now, a small part is what you call the squamous cell carcinoma, around 18%. And usually they can appear as flat lang or can be big masses. Now, 2% would be the rest of the skin cancers that we usually encounter rarely, like dermatofibrous sarcoma protuberans, histiocytomas, marami pa yan, pero 2% lang sila most of the time.
Thank you for sharing those mnemonics and for those differentiations, Doctor. That's very good. Can you tell us what are the causes of skin cancer?
Actually, marami, but 80% of the time, it's still chronic sun exposure. That usually it's because of the UVB radiation. Now, 20% is accounted for by other chemicals like your coal, arsenic, exposure din sometimes to radiation. And of course, you cannot discount the role of genetics. Kasi meron talagang mga tao na they're really prone to having mga dysplastic moles.
Yes.
Na kala mo ba mga irregularly shaped moles, and they can transform to melanoma even at a very early stage, very early age.
What would you say are the current treatment modalities for both non-melanoma skin cancer and melanomas, Doctora?
Well, actually surgery pa rin ang pinaka-gold standard for both, no? For melanoma, the gold standard will still be wide excision. For basal cell and squamous cell, actually, the gold standard now is what we call Mohs surgery. Beyond surgery, there are still other modalities, mga non-surgical like cryotherapy, pwede rin namang radiation, pwedeng application of some chemo drugs, but of course, the cure rate is lesser than the gold standard, which is surgery.
Okay. Sorry to interrupt you, Doctora, because we have a viewer that typed in a question, and it says, What is Mohs surgery?
Well, actually, Mohs surgery is a special kind of surgery. It's done wherein you try to excise the tissue unti-unti while you try to look at it under the microscope, well, where the cancer extensions are going. Unlike in wide excision, you just get one hole, like let's say 2 centimeters around, equally on all sides, right? In
Yes.
Mohs surgery, you try to follow the extensions with the use of systematic frozen sections na cut in a different way. Actually, we call it tangential cut. Okay? And with Mohs surgery, kasi we were able to account for all the extensions because we examined the whole margin of the lesion. And they have found out that you can cure skin cancer, especially non-melanoma skin cancer, as high as 99 to 100%.
Wow.
Yes.
So, now that you explained to us the current treatment, how would we be able to diagnose the skin cancer, Dr.?
Actually, the best person to help you would be a board-certified dermatologist.
Yes.
Right now, we usually use what we call a dermatoscope first.
Yes, Dr.
Yes, so to help us see if the lesion is suspicious enough to be biopsied. If we see some signs na suspicious yan, then we go for either a punch biopsy or an excision biopsy.
It's funny that you mentioned that because I brought my dermatoscope
Wow.
with me because this is really the instrument of the dermatologist. So this can guide us better in determining which moles or which lesions are suspicious because of course we can't do biopsies
On
on
wall.
correct.
Yes.
If they have like a
Dami-dami
dozen
cup.
correct.
Yeah.
So this is like our handheld microscope to guide us in our diagnosis of which are the possible lesions that could be cancerous.
Yes, actually that's very, very helpful.
So I think we could improve our diagnosis. I forget the percentage, but they say it increases the percentage of likeliness of, I don't know, maybe it increases it by 70, I'm not sure, 75%?
Yeah, at least you don't really have to cut everything.
Yes,
if
that's
you're,
right.
Yeah, if you're suspicious about it.
So, we have one of these in our dermatology center. It has a camera and it can aid, and we can do skin screenings downstairs actually in our dermatology center.
Yeah, actually that's very important. Skin cancer is really preventable. If you come to think of it, 80% is due to the sun.
Yes.
So if you try to avoid the sun, 80% of the time, pwede ka na mag-avoid ng skin cancer right? Now, with the help of screening, regular screening, especially with your dermatologist, with a dermoscope, you can also increase the prevention rate of skin cancer. Kasi bago pa man siya mag-change, pwede mo na siyang agad mabiopsy at maalis kung kailangan.
Oh, Doctor, I believe that early detection is going
Yes.
to be give you a better successful treatment. Also, what would you say the interval between the checks is? It's going to be like
Well,
once a
it
year?
depends. If you're high risk, it would be good to have a check every 3, 6 months, and then a year. But of course, kung medyo low risk ka naman, pwedeng yearly lang. And you can even do it yourself. Just look at the mirror, do it systematically, and have
Yes.
somebody look at the back, every inch of the skin, and you can find out if there's a suspicious lesion on you.
Sometimes I even ask my patients just to take pictures because sometimes we forget so that they can compare.
So they can remember.
Yes.
Yes, that's very. And of course, the use of sunscreen for prevention.
Yes.
Since alam mo na nga na 80% of the time, radiation from the UV.
So since we're on the topic of sunscreen, what amount would you say is the right amount of sunscreen to use?
Actually, I think it's the use of right sunblock, the SPF that you have to know, and then the frequency of applying the sunscreen, diba?
Yes.
That's more important than the amount that you put.
So would you say that every 4 hours is appropriate? Every 6?
2.5 to 3 hours, you have to reapply your sunscreen, especially if you're in the beach.
Wow. Okay. Well, with that, that's going to bring us to the end of our session, I believe. I think we're
Yes.
running out of time. So, Dr. Tan and I, we hope that you learned a lot about skin cancer. So, if you see any suspicious skin lesions, please consult a board-certified dermatologist from the Philippine Dermatological Society. Thank you all for watching. Have a pleasant evening. I'd like to thank Dr. Tan
Welcome,
for
Ivan.
a very good
It's my pleasure.
session. Thank you for
Yes.
coming.